Good morning, Kimberly.
Good morning, Mrs. Vermillion.
How are you doing today?
I'm nervous about giving meds, but I'm excited too.
Okay. Well, I'm here with you.
Okay.
I just want to remind you that every time you administer medications in our semester, you're going to be with a faculty who is there to support you.
Great.
Okay? So this morning I noticed on Lydia Ocampo's medication administration record that you have potassium due. Is that correct?
I do. I have potassium due. It's 20 milliequivalents of potassium. It is due every day
Okay.
at 9 a.m.
Okay. And did you do your medication assessment tool on your potassium?
I did. I did
Okay.
my potassium
Can I
mat.
see that?
Mhm.
Okay. Good. Very nice job. So why don't you talk a little bit to me about why Mrs. Ocampo is receiving potassium today?
Okay, Mrs. Ocampo has coronary artery disease, and her normal medication that she takes for blood pressure is furosemide or Lasix, and that means that when she uses the bathroom, the potassium goes out with the urination, and so we want to make sure that we monitor her potassium level.
Okay.
And so today it's 3.3.
Good.
And so we need to make sure that we give her her dose of potassium this morning. She gets it every day at 9 a.m. And it's something that she's on at home as well with the potassium. And we want to make sure that she stays on the potassium because it can affect the heart.
Okay. So what do you expect to happen after you give the potassium? Do you expect her lab level to go up, stay the same, or go down?
I would hope that it minimally stays the same, but it's by mouth, and so just once a day. I'm not sure if it will go up dramatically, but that would be our hope, is that on the 20 milliequivalents every day that it would go back up to at least a 3.5 and be a little bit more normal.
Okay, and what's a normal potassium?
3.5 to 5.0.
Okay, great. All right, well, it sounds like you had all of the information that you needed.
Okay.
It's extremely important for you to understand why your patient's receiving the medication, as well as monitoring any lab values. Have you done your baseline assessment this morning with vital signs?
I did, and her vital signs this morning are 120/80, and her heart rate is 78 this morning. Again, with her potassium level, with her 7 a.m. lab this morning, was 3.3.
Okay, great. Okay, Kimberly, so we have gone through and already discussed why you're giving Mrs. Ocampo the potassium. So now we're going to pull it out of the medication administration dispensing unit. Okay? So what I would like you to do is, you already have your username and your password. So I would like you to go ahead and just enter it in the sign-on and password section.
Okay.
Now press enter.
Okay.
Okay, so you didn't enter the correct password, so let's go ahead and hit OK and enter that again. There we go. Okay, go ahead, and on the system it says that you're entering into the patient's medical records, so go
Okay.
ahead and hit OK. All right, now what I want you to do is, all of the patients for the unit are here on the screen. We can either arrow up or down to find our patient, or we can simply start typing in our patient's last name.
Oh.
So why don't you just go ahead and type in Ocampo. All right, and once it's highlighted, what I want you to do is compare your patient's name and date of birth against your medication administration record.
Okay, so I do have Ocampo Lydia, and that is her room, but I also need to check for her date of birth, and that is August 9th, 1947.
Okay, good. Sometimes there can be more than one patient on the unit with the same last name, and so it's important to check those identifiers. Okay? Now this is a touch screen, so I want you to simply touch Lydia Ocampo's name. All right, and this brings up all of her medications that she is on.
Wow.
Okay, so I want you to find the potassium chloride and I want you to touch that medication on the screen.
Okay, so I see potassium chloride here, 20 milliequivalent. Okay.
Okay, and hit OK.
All right.
All right, and so over here it tells us potassium chloride 20 milliequivalent tab. The ordered amount is 20 milliequivalents. And so in this case, we only need one tablet, correct?
Yes.
Okay, so I want you to touch the number 1 on the screen.
Okay.
And now hit enter on the screen.
Oh, it's on the screen. Okay.
Okay, and now down here it says press to open drawer.
Okay.
Go ahead and touch that.
Oh.
All right. So now it opened drawer 17. The first section is A, but we
Okay.
still always need to verify in case it was stocked incorrectly by the pharmacy.
Okay.
Okay, so what I want you to do is I want you to read your drug name and dose off the package and compare it to the screen. And then you're going to read from the screen the drug name and dose and compare it to your package along with the expiration date.
Okay. Okay, so first I have potassium chloride, 20 milliequivalents. And that is a tablet, and it does expire on March 4th, 2020.
Okay.
And I have potassium chloride, 20 milliequivalent tab. And checking my package again, it does expire on March 4th, 2020.
Okay, great. So now what we're going to do is you've got this red flashing bar. Press here when you're done. Go ahead and touch that.
Okay.
And you're going to push in your drawer.
Okay.
Okay. Now, we don't want to just walk away because somebody could come underneath you and take out medication who's either not authorized or who maybe is authorized, but you don't want it under your login name.
Okay.
So down here in the corner, you need to click or touch sign off.
Okay.
And now the login screen is here.
Okay.
So
All right.
Kimberly, this represents our first check of medication administration. Okay?
Thank you, Mrs.
All right.
Vermillion.
So let's go to Mrs. Ocampo's room,
Okay, all right. Hi, Mrs. Ocampo. I'm Kimberly, and I'm your RCC nursing student. I did do your assessment this morning,
Oh, yeah.
and I need to give you your medication called potassium this morning.
Okay. I think I take that normally.
Okay, you might take it normally because you take a medication called furosemide every day for your blood pressure.
Oh, okay.
And so you might know it as a water pill.
Yes.
That when you take your water pill, your body excretes potassium.
Oh, okay.
Have you heard of that?
Yes. That's why they want me to eat a banana every day.
Absolutely, yes. So you kind of have to take the water pill along with the potassium every day.
Okay.
And
yes.
we have it ordered for you for in the morning at 9 a.m. for your potassium.
All right.
Okay, any questions about your medication?
No. I think I've been on it for quite a while.
Okay, well, your lab is 3.3 this morning, so we need to make sure that you take that potassium every day, and you eating a banana every day also helps to keep
Okay.
it
All right.
within normal.
All right.
Okay, alrighty. So I'm going to go out and just stand here at the computer and get your medication ready with my instructor, Mrs. Vermillion.
Oh, okay.
Hi, Mrs. Ocampo.
Hi.
I'm just here to be with Kimberly. And so we're just going to prepare your medication and then I'll be here with you, okay?
Okay, thank you so much.
Uh-huh.
Okay, alright, Mrs. Vermillion. So I'm going to go ahead and sign on to the computer.
Yes, go ahead and type in your username and password. And then you're going to select the medical surgical unit since that's the unit we're on. And find your patient.
Mrs. Ocampo. And I have her date of birth verified.
And you're going to go ahead and press the little paper clipboard next to her name.
Okay. Oh, her whole medical record.
Yes, her whole medical record is here. Now, Kimberly, have you already checked your provider's orders
I did
this
check her
morning?
provider orders, but I'd happy to bring it up for you as well.
Okay, I would like to just take a look at it. So you've already done the reconciliation.
I
Is that
did do my
correct?
medication reconciliation this morning,
Okay.
and I have my patient's name and my patient's date of birth.
Okay. And that's our
And-
first right of medication administration, correct?
Yes, yes, but I have to
Okay.
ask her about her allergies.
Okay. Why don't you go ahead and ask her the allergies while I verify the medicine?
Mrs. Ocampo,
Uh-huh.
are you allergic to any foods or medications?
Oh, not that I know of.
Okay, alrighty.
All right. And if you wouldn't mind, can you just hit the lab tab so that I can also
Yes.
verify her
Yes.
potassium this morning?
Yes, and so it was her potassium this morning.
Okay. And go ahead and drop that arrow down to the time, 7:15 this
Yes.
morning. And go ahead and scroll down. Okay, 3.3.
Yes.
Great. Okay, so now why don't you identify your patient? Go ahead and scroll all the way up on the medical record, and you can compare her name and date of birth.
Okay. Mrs. Ocampo,
Uh-huh.
would you please give me your name and date of birth?
My name is Lydia Ocampo,
Okay.
and I was born August 9, 1947.
Okay, and that matches your medical record as well.
Go ahead and scan.
Okay.
All right. And now you can go ahead and select the MAR portion of the medical record. And why don't you go ahead and scan your medication now? And just like we did at the medication dispensing unit, we are also going to read from package to computer screen and computer screen to package.
Okay, but first I'm going to scan.
Yes.
Okay.
Okay, good.
Alrighty, and again, I do have Lydia Ocampo, and her date of birth is August 9th, 1947, and no known allergies.
Okay, great.
Okay, and so what I do have is I have potassium chloride, 20 milliequivalent. It is in tablet form. I am giving it at 9 a.m. daily, and the expiration on my package is March 4th, 2020.
Okay, and what route of administration is this?
I'm giving it by mouth.
Okay,
So I have here 20 milliequivalents of potassium chloride. The route is tablet, frequency is daily, and I am giving it the 9 a.m. dose.
okay, so we have now verified that we have the correct patient,
Mhm.
we have the correct medication
Yes.
at the correct dose
Mhm.
via the correct route and the correct frequency.
Yes.
Okay, and then our last right of administration will be the correct documentation.
Okay.
And we also have the correct time of 9
Yes.
a.m.
Okay.
Okay,
Great.
all right.
Okay.
So why don't you see how Mrs. Ocampo would like to take her
Oh.
medicine?
Okay, Mrs. Ocampo, I have your potassium, and do you want it with a sip of water? Your
Yes,
potassium
yes,
this
I think there's
morning?
some water in my cup there.
There
That's
is,
fine.
absolutely. Okay, and you're okay with swallowing
Yes.
your potassium?
Yes, I'm used to
Alright.
taking those pills.
Okay. I'm just gonna raise the head of the bed up just a little bit.
Okay, good. That's better. Thank you.
You're welcome. Okay. So I'm gonna go ahead and open your medication. And put it in the cup here.
Go
Okay.
ahead and save your package, Kimberly.
Alright. Mrs. Ocampo, here is your medication,
Okay. Thank you.
and here is your water.
Okay, just a little sip and I'll get it the rest of the way down.
Okay.
Okay, good. Thank you.
Uh-huh. Alrighty, Mrs. Ocampo, I'm gonna go with Mrs. Vermillion and do the documentation of your medication.
Okay.
Your call light is here in place if you should need anything. I'm gonna go ahead though and keep the head of the bed up for at least 30 minutes while your medication has a chance to get to the stomach and the bed is in the lowest position as well. But if in the
Okay.
meantime you should need anything, please call me and I will be in. If I don't hear from you, I will be back in 30 minutes.
Okay, thank you very much.
It was really
Thank
nice
you.
to meet you, Mrs. Ocampo.
It was nice meeting you. Thank you for coming in here.
Yes.
Okay, alright.
Okay,
Mrs.
Kimberly,
Ryan.
so now you want to go ahead and select given
Okay. And I want to do my final
and do your final
verification.
verification. Now, it's already gone into your patient's
Yes, it
stomach,
has.
but we could still report a medication
Mhm.
error if there was an error.
Right, okay, so I do have the correct patient, and that is Lydia Ocampo, and her date of birth is August 9th, 1947, again, no known allergies. I did go ahead and give her her potassium chloride, 20 milliequivalent. It was one tablet, and the expiration is March 4th, 2020. I did give potassium chloride. The ordered dose is 20 milliequivalents. It was one tablet, ordered daily, and I gave it at 9 a.m.
Okay, so now the time given,
is 9 a.m.
9 a.m.,
Mhm.
okay.
And
And in the notes, it's always good to make sure that you list what the patient's morning potassium level was so that it
Oh.
shows that you did in fact check that prior to giving.
so my sixth right is the documentation.
Yes.
Okay. Excellent. Okay. And then
Put
I
your
need to put
initials.
my initials. Okay.
And now we need to go up to the little save box to save our documentation.
Okay.
Remember, if we don't document it, it wasn't done. It's always a good practice to go back and make sure that your documentation was recorded. So go ahead and scroll over to the 9 a.m. and see if you see your initials.
Okay. Okay, so at 9 a.m.
Okay?
Okay,
All right. So
thank you
just
so
like with the med
much.
dispensing unit, we never want to walk away with our electronic health record open. So you need to go ahead and go up and log out.
Log out. Okay.
All right. And now you can go ahead and place your barcode scanner back. And we always want to make sure that we leave our cart plugged in so that it is ready for the next person.
Alrighty.
And we did put the brake on,
Oh,
so
yes,
you'll want to
we
release
did.
that brake. Let me help
Get
you
my
out
foot
there.
underneath there. Okay, thank you, Mrs. Vermillion, very much. Okay. Thank you, Mrs. Ocampo.
Oh, you're welcome. Bye-bye.
And make sure you gel out on our way out.